This is a step-by-step guide to the urgent care documentation. This will demonstrate the standards which are expected when completing this document. So you should all recognise this documentation. And firstly, it's important we ensure there is a identification sticker at the top and that all the patient details are correct. For the purpose of this exercise, we are admitting a lady called Jane Knight. Jane is 39 years of age and we have the correct telephone number and we have documented her occupation, her civil status and her ethnic origin. It's important we get the next of kin details. So we have Stephen Knight, who is her husband, we have his address and his home phone number. Continuing to the next page, it is important and often missed that we ask Jane her religious or cultural requirements. We need to document Jane's preferred language. And continuing from the next of kin details, we need to ask Stephen for his mobile number and to ensure he is aware of Jane's admission. An interpreter is not required, and we can inform Stephen of any updates necessary overnight. It's important that we have the correct GP details, so we have Dr. Smith from Kettering Medical and we have a contact phone number for him. This is important in case we need to gain any extra patient history. Every patient that is admitted must be weighed and Jane weighs 120 kilograms. And we need to document any allergies or intolerances. Jane is allergic to penicillin and she developed a widespread rash on her last admission when penicillin was administered. Yes, we have completed the sepsis screen for Jane. No, she does not have a community DNA CPR. If she did have one, it would be vital for us to have a hospital updated one which has been signed. So our SBAR handover, so the situation is we have a 5-day history of lower back pain with pain on passing urine, and Jane has a 2-day history of a high temperature with an increased respiratory rate of 26, and she has increased lethargy. Her background is that she has had previous admissions with UTIs and has recently been on oral antibiotics. Our assessment, patient looks unwell, she looks pale and she has a NEWS of 5. And recommendations is that patient hits the sepsis markers, therefore requires antibiotics and fluid to ensure we meet the goals of sepsis within that golden hour. Again, we need to make sure that we have the correct identification sticker at the top and that all the information is correct for that patient. We must then ensure that each member of staff that documents within this documentation has clearly written down their role, the area that they're working, that they print their name, they sign, and they put their initials in. This applies to everybody, student nurses, registered nurses, HEAs, NAs, and anybody at all that documents within this. So property record and disclaimer. We must give all patients the opportunity to keep their valuables safe. Jane has chosen not to do this. We can also document if the patient has any of the following with them. Jane does not have dentures, hearing aid. She doesn't have her own medications or walking aid. She does, however, have her own mobile phone, which is with the patient, along with her phone charger. And she doesn't have any glasses or watches or jewellery. Jane must then sign to acknowledge that she understands the trust policy. And then we can also sign. So for each patient that comes in, it's important that we check to see if there's any Medway alerts. Jane does have an alert on Medway, and that is her penicillin allergy. Other alerts could include if the patient has a learning disability, or if they've been a victim of domestic violence, or if they have had violent behaviours towards staff. Does Jane have any known infections? No. This could include previous C. diff or MRSA. And is the patient confused? No. And she doesn't have any of her own medications. And then for each patient that comes into the wards, we have to ensure they're given all the patient leaflets. As you can see on the left, there's a number of them that we must sign for and date to acknowledge that they've been given. So we need to do an initial skin assessment on each of our patients. We can have this conversation with Jane. And she does have a moisture lesion to her sacrum. She also has some dry skin on her left calf, which you can see circled. So box A will correspond to her moisture lesion on her sacrum, and we can document that here in the box. And then again, the same for the dry skin on Jane's calf. It's non-blanching dry skin on left calf. The patient's aware and she is actually treating this at home. So continuing to the pressure ulcer risk assessment purpose T form, we know that Jane walks independently and there are no mobility issues. She does have vulnerable skin. She has the moisture lesion on her sacrum. She does not have any conditions which could impact the risk of a pressure ulcer. So she is actually at risk, so we're not going to tick the green box. I'm going to continue on to step 2. Jane does make frequent changes. She's able to mobilise. She has no issues with sensory perception and response. And she does have a constant moisture lesion to her sacrum. There's no perfusion issues and no nutritional issues. And she has no medical devices. Jane is not a diabetic. So we do have some vulnerable skin on the sacrum, so we're going to tick the orange box. And the rest we can just simply tick as normal skin. We can document that there is a rash to her right calf, which we can tick this as potentially vulnerable skin. Jane has no history of any pressure ulcers. So we're going to tick the orange box here because she doesn't have a pressure ulcer, but she is at risk of developing one. We can then print, sign, date and time.